This particular project is one that has been in the works for a while now. Before I kind of roll into some very brief remarks, I want to make some quick welcomes. First and foremost, Camille Lloyd from the Gallup organization, a dear friend. We've been partnering with Camille, and she's been tolerating us now for many, many years. The commitment that Gallup has put into this project, the pro bono work, if you will, effort that the resources, if you will, that they've put into this project has just been phenomenal, and it just really shows an incredible commitment to this kind of work focused on equity. Her colleague Christian is also here. Thank you for making the trek, planes, trains, and automobiles to come to Mackinac Island and the Mackinac Policy Conference. And of course, also with me is my friend and colleague, Marnita Harris, who you'll hear from shortly. So the goal of our work with Gallup has always been to leverage Gallup's incredible world-class data, thought leadership, and their 100-year commitment to study the real-world experiences and thriving levels, and you'll learn more about that in a minute, of Black America for the betterment of the Detroit region and, frankly, the nation. First, we partnered with Gallup on a very different kind of survey in the Tri-County Detroit metro area. That data has been available for quite some time. It is deep, it is unique, it goes beyond things like, what's the unemployment rate, or do you have access to a car? It really measures, again, the real life experience of all the residents in the region, but we really kind of drill down, if you will, on Black Americans. And what you can do with the data is phenomenal in terms of its flexibility, its ability to compare. But what we have lacked, and what today's announcement is all about, is to provide a super easy to use, in-depth, multi-source data site available to anybody and everyone completely free of charge. So you can do your own analysis down to the neighborhood level. You want to know how one neighborhood in Detroit looks, feels, compared to another one, or compared to national data, you'll be able to do that in a way that has never been available before. And in addition to the data that we have done with Gallup for our own survey in the Detroit region, the national data through the Center on Black Voices from Gallup will also be available through this site. And in addition, as we continue to build out this site, you'll be able to access data from other organizations, other trusted organizations. For example, the Detroit Regional Chamber, as many of you know, collects a tremendous amount of data. We want that data to be available through that same portal, and that will be part of this project. But other organizations, such as data from the University of Michigan Poverty Center, Data Driven Detroit, other trusted organizations that have been partnering with us for several years now, will be available through this site. So super, super excited about this project, what it will mean, for philanthropy, in terms of how philanthropy makes decisions, public officials at all levels, how they make decisions, how they can understand the impact of their investments in certain communities, certain cities. Is it moving the needle or not? We'll be able to, this data will help inform those kinds of decisions. And of course, for us being a business organization representing businesses too invest in communities in different ways. This will be a wonderful tool for them to use as well. So again, welcome. We're delighted that you're here today, and I really look forward to you all seeing what this powerful tool will mean for the region. And with that, I'm happy to turn it over now to Gallup's Camille Lloyd.
Thank you. Good morning, everyone. I get giddy and excited. If you all ever heard me talk about this Resident Voices data before, I get excited about data, but I mean, I chose to work at Gallup, so. As Sandy mentioned around the survey, so just a little bit of background related to the survey that was done in 2022, and that I think we shared that data here. The report has been publicly available. One of the things that I want to convey to you all is the magnitude of this research and the data that is driving the engine that we'll look at this morning. Is really, we surveyed over 12,000, almost 12,000 residents completed the survey. But what that looks like for residents in the city, 1 in every 10 households got a survey that they could complete in survey. So just to let you understand the magnitude of what's driving this research hub. So what I want to do is to go through what we call the Detroit Resident Voices Data Dashboard. And it's really a research hub, as Sandy mentioned, that is putting together all the research that exists within the area and to have it be publicly available and accessible. One of the things about us as researchers, and I'll fall on our sword, is we do this great research and it's hidden under a bushel because it's not accessible to those who need it for their decision making, but to also be able to have residents see, like, you invested the time to respond to the survey, hear what the results say about what your experiences are. And so part of that process is we think that this ability to access this data as a community is a way that we are democratizing this process of data sharing, but also decision making when it comes to putting resident voices at the center of those important decision making conversations and having it based off of objective data on resident experiences, right? So I think it goes quite well with the theme about a common ground. We believe that data also give us that common language. And when we started this project, oh gosh, it's almost 6 years ago, Sandy, part of it was to say, how do we get everyone singing from the same sheet of music? And that is saying we should have data be that force, right? That unites us if we all agree on the measures. So with that, I'm just gonna go through what this dashboard provides, what are the features and how you can how it brings together that complementary and supplementary data when we think about all the data that exists within the ecosystem. So looking at overall on the top of the page, you'll see a different tabs that you could use to navigate about the research. So a little bit of that background around the studies and the research that is behind the dashboard. There's also an interactive map. There are data tables that you could use to access data in a snapshot view. There are FAQs. There are also data highlights to say, what are these primary takeaways that we're looking at from the research? And then they're also linked to prior research from our partners. As part of that data group, when we started to do this work, our goal was to not come in and do the same research over and over, but how can we do research that fill in the gaps? That's also supplementary and complementary. And how do we put this together in a well-packaged resource so that you all can have access to it? All right. As part of this, what I want to do is to just show you a little bit about what it looks like to have data at a level that is granular enough that you can kind of see the different experiences that we heard from residents in terms of their everyday experience across residents in the region. So as part of the research, one of the big question we had was, how are Detroiters doing? And as part of that question, we created the measure around thriving. And so we asked 2 main questions, and that is, how would you rate your life today from a scale from 0 to 10? Worst life possible, best life possible. And then we ask you where you see it 5 years from now. And what we were able to do with that question is to create a measure of thriving for Detroiters. And that gives us a comparison, not just with individuals who are living within the region, but we also, Gallup collects this measure for the country, and we collect this measure as part of our world poll. So we can see how Detroiters are doing compared to pick a country across the world. And so what that allows us to do is to, in a quick way, to look at what's that number in terms of answering the question about how Detroiters are doing. What you are looking at in terms of this map is really a breakdown of that across neighborhood. And you'll see the different shadings of green, from green to yellow. And what that's telling you is based on the percent, it's overall percentage of residents who are thriving across different neighborhoods. And I want you to pay attention to the details of like what's dark brown, what's dark green, what's light green, what's yellow. But it's really to just depict the variability and experiences that we captured, right? This is the nuance and the data, and that we are not all experiencing lives the same way, even if we live in the same geography, because you can have adjoining neighborhoods and you see different percentage of overall thriving. So the idea is to also show you, right, the difference in experiences across residents. What I want to talk about specifically is how we're using the dashboard to connect the different discrete data that's available across the region in a way that allows for you to see it. So let's take this measure of thriving, for instance. We know the biggest thriving about how Detroiters are rating their lives in terms of those two questions I mentioned earlier. We know that if you can give a 5 to the question, I feel by working hard, I can get ahead by working hard. If you're giving that question a 5 and you live in the region, you're much more likely to be thriving in your overall well-being based on the measures that I just told you. And what we want to look at is, so what does that look at if we take those two variables and put them next to each other? What does that look like? And so this particular dashboard will allow for you to do that, which we're going to compare two different measures and see how that looks across different neighborhoods. Are we taking questions now, or will we wait till at the end? We'll take them at the end, okay? All right. So for instance, we're looking at the measure of thriving and financial goals. So we ask a question on the survey, right, about people's level of confidence in their ability to make their financial goals. As you can imagine, a measure like that, there are a number of different things that goes into that measure. And that measure will show you, okay, am I confident because of the access that I have to job, training, the ability to get the job that I want, the education to have the job that I want. And so what you are seeing on the screen now, let's make sure that this is showing, is where we see high levels of thriving and high individuals who are confident about their ability to meet their financial goals. And what's just highlighted here, when we look at those who are high in thriving, but also rate that question high, which is they have high confidence in their ability to achieve their financial goals, what you're able to see with the map is that by neighborhood level. We could also look at it at the county level, right? In terms of the cross-section of those two variables, high levels of thriving, high confidence in your ability to achieve your financial goals. We could look at it at the municipality level, right? So this is the ability to manipulate the data, the massive amounts of data that we have, and look at it at the level of relevance to you and the questions that you have, right? So this is one way that we can use this dashboard and this map, and we could do it for any measure within the survey, right? So we can let's look at education, right? We can look at what are individuals' rating in terms of their overall access to education, and you could look at it on any measure. You could look at, say, one of the beauty about this data is we're putting together not just the survey data, but the existing data around the transaction of life, right? There are tons of data around economic indicators, education indicators within the community. And so I'm gonna go down here and just show you a little bit about how this is bridging the gap between the existing data and resident voices data. So I'm gonna look on the external data. So we have access to quality education. So this is a question that we ask residents around for them to rate their level of agreement that all children in their neighborhood have access to a high quality public schools. And what we can then look at is looking at those survey responses, and we can compare it to student proficiency on exams, right? And again, we can look at this data at the neighborhood level, right? So you can see here's where we have residents' overall assessment that they strongly agree that students have access to quality public schools, and what we see in high proficiency scores, right? And so you can look at the variability across neighborhoods, like I mentioned earlier, by municipality, and by county in terms of any measures that exist on the survey, which is a question about resident experience, as well as any data that we have out here around some of those key indicators on student outcomes, economic outcomes, education, presence of vacant homes. So we have a neighborhood aesthetic variable that you could also look at versus the percentage of vacant housing within a neighborhood, within a municipality, and within a county, right? So this ability to visually depict the combination of any series of data that we have available in the dashboard. Some of us are visual learners, right? So some of us wants to see which one's light green, which one's yellow, which one's dark green. The feature on the hub that allows for us to do that in a quick, easy way is this map. Okay, so that is the map view on there. Existing on this hub is also the comparison. Sandy mentioned earlier how it is important to not just know how the region is doing, but how is the region doing compared to some really important national benchmark measures, right? I think that's the beauty of the partnership that we have, which is that ability to take measures that Gallup is not only just asking as part of the Detroit Resident Survey, but measures that we're asking at the Center on Black Voices nationally. And some of these measures are measures that we ask internationally to see, okay, I think there's a theme now that's going on about, like, is the house on fire? Well, how big is the blaze? This kind of helps you to contextualize that data by looking at some key comparisons. So for again, those same breakdowns, county, municipality, neighborhood. So what you can do with this data table, it takes, for instance, economic indicators for the Detroit region. And what we are looking at are some key economic indicators around the satisfaction, that's a resident voice survey measure, with the availability of quality jobs. Then we're looking at a really hard, what we call a transactional measure around the participation rate, right, in the labor force. Or we look at it across the unemployment rate. So what this data table is allowing you to do is to compare some key important measures that you're probably used to hearing, used to looking at, and let's pair that also now in a data table with the Detroit Resident Voices data about how satisfied residents feel about the availability of good quality jobs. But not only is it giving you that, but it's also giving you a frame of reference that's national, tri-county, or city level. One of the things that we did when we surveyed and created the sample frame is we knew that the region was the sample area, but we also knew that it's important, if we're thinking about this through an equity lens, that we can understand what it looks like within the city proper, right? And so what you have is that ability to see how these measures varies across these. So for instance, I told you that Durfee, one of the things where you could go in here and just type in a particular neighborhood, a county, or a municipality, and you can kind of see how for these economic indicator measures, and you could change it if you don't want to do the economic indicators, you could do healthcare indicators, housing indicators, or education indicators. So for instance, when we look at it as far as healthcare indicators, how is Durfee doing, right? That's one of the areas where we look at overall, education, thriving, that was one of the communities that was surprising in terms of when we look at some of the hard data, it was counterintuitive to see the high levels of thriving that exist within that community. And when we start to look at, well, what are those other indicators that might be improving or changing based on what's happening around? So for instance, when we look at Durfee, and we look at, for instance, the satisfaction with the availability of quality healthcare, we see that 51% of residents are satisfied. Well, what does that look like when we compare to the city? It's right on par with the city. When we look at it as a region, it's below the region, right? So this is what it allows for us to be able to do, is to look at your data within the context of some important comparison to say, as things start to change, how do those changes reflect where we are in the larger ecosystem and looking at our benchmark, right? So if we were to look at, for instance, the economy, or we were to look at education, right? One of the things is just being able to understand from a comparative standpoint where those data are. The other thing that I want to also talk about is there are tons of resources on the site itself to be able to access and answer questions related to how to use the site. The other thing is we do also have different ways of visually showing key measures, right? So one of the things that you're looking at here are some pullouts on highlights by county, municipality, and neighborhood. So always think about it. We have the ability to drill at different levels starting at the high county level, going all the way down to the neighborhood level. Okay. The other thing that I want to also quickly point out is the ability to link not just the survey data with external data, such as those hard other economic indicators or health indicator data, but to be able to say, what are our overall perceptions from the survey standpoint related to that particular topic? And this is what this section of the website is showing you when you look at some of the highlights. All right. With that, Marnita, I'm going to turn it over to you.
Okay. All right. So, oh, there I go. Okay, so what we're going to do is you've received this preview this morning, but this summer the Chamber will host a virtual overview provided by Gallup and of the Detroit Voices data dashboard for businesses, government, community, philanthropic leaders. So we will be sending that virtual session for us to do a little bit more of a dive down into how you can use the Research Hub. I want to take this moment to really thank the funders who made this possible. They've been partners along the way with our survey. That would be the Barmer Group, Gilbert Family Foundation, the Kresge Foundation, and the Skillman Foundation. With their support, this made all of this research and this continue on and to be possible. Again, I'd like to mention our data partners, Poverty Center and the Detroit Future Cities and Data Driven Detroit. And one thing I want to, Sandy mentioned it, but you will be able to access all of their data as well, because this will help us to continue to supplement this data, and you have access to a wealth of critical data resources for the Detroit region. I want to pull up my QR code, please. So if you scan this QR code, this will allow you to access the Detroit Voices data dashboard. So you'll be able to get to it through your phone. Right now, if you wanted to take a look and kind of play through the actual dashboard. We also have stations available for you to try it out live. And I just want to thank you all for your time this morning. And I hope each of you use this tool as you seek to make strategic decisions to improve the quality of life of our residents in the Detroit region. And I would be remiss, this partnership, when I started this work, I was not a data person working at all. Working with Gallup and our data team, who is fantastic at the Detroit Regional Chamber, I have become a little bit of a geek. And so I just want to thank you all. Again, I would like to thank our partners, our funding partners, as well as our data partners. So thank you so much.
So recognizing that this type of population data is always lacking, okay? The census is 10 years. What strikes me about this is this data was collected mid-pandemic. And at this point, that was 5 years ago. I'm wondering how you all are thinking about interpreting this data and what it says about Detroit now, given the context in which it was collected, which was not normal times.
Well, it was actually collected post-pandemic. So we were.
Oh, I thought it was 2022.
Yeah, we were out and about.
We were out and about in 2022.
So end of fall 22 into winter of 23.
Yeah, so it was collected at the end of 2022, which was the fall, and then into January of 2023.
Oh, okay. Okay.
He has.
All right. First, great presentation. I actually was one of the people that actually did one of these.
Yay!
Can I shake your hand every time somebody says, Gallup, you have never surveyed me, and now we have an example of somebody saying.
She did it too.
So remember, in the city, 1 in every 10 household, that level of coverage as a survey researcher, we almost never get that lovely opportunity to be able to do that, right? Because again, you know, the sampling, it's representative, but to have that level of coverage and to have 2 people in the room who said they got a survey.
Yes, and a funder.
Yes, I love
a funder got it at her house. I was very excited about that.
But then again, my house, I don't know what happened in my house or whatever. I've been like a Nielsen household forever too. So I know it's like, you know, they're like, who's watching this on TV? But
I love that.
The question is, like, on some of the map, it was like white spaces
Mm-hmm.
on some of the maps. So I would just ask that question. I saw Hamtramck was lit up on one of those maps, but didn't see Highland Park, which I'm imagining that may change everything. So I had a question kind of there, and then also I thought it was unique. The close to near perfect health was higher in Durfee for most. So I guess I just dive into that, but that just kind of was interesting.
So to your first question around the spots on the graph, so to be responsible in our data reporting, we have a threshold of wanting to have at least 100 completes to share, because again, we want to make sure the estimates we're creating for the neighborhood are stable estimates. And so if a neighborhood is white out or blanked out on the map, it's because we didn't have enough survey completes within that neighborhood. And so the goal is to make sure that whenever we're projecting estimates on a neighborhood, we have enough completes that's representative of the characteristics of that neighborhood. And so that's why something wouldn't have a shading color on the map, is that particular neighborhood didn't have enough completes on that particular question. And then what was the other question you had about the...
Yeah, I just found it, like, I mean, I guess I'll dive into that, but the near perfect health in Durfee was higher than the U.S. and the Tri-County region. That was interesting.
Perception.
Yes, right? It's the perception of individuals. So a lot of that particular near perfect health measure, so that's one of those outcome measures. When we look at people's ability in terms of what they say in accessing quality care, right? So having access to quality health care. And we dove deeper into some of that Durfee number, because it's one of those neighborhoods that lit up on the map when we see higher levels of thriving versus some of the harder outcome indicators that people are saying, well, that doesn't make sense or it's counterintuitive, and started to see what are some of those things that are happening in that neighborhood that might be driving residents' perceptions related to their access to quality care and how well they feel around agency and being able to have near perfect health.
I would like everybody to remember that this is not a survey that's measured like the Census Bureau or something like this. This, like, you filled it out. So your perception of time, of what you're feeling like in your life at that moment, is the Detroit. That's why we keep saying Detroit voices, Detroit residents. This is not something that is aggregated from, you know, the regular types of data that is collected, like the Census Bureau and all that. This is coming directly from you.
Yeah, and I guess as a person that took it, yes, it was almost like I had to look at it as like a college. It's like, yes, you have to sit down. It took some time. It was many questions. It was not like, you know, vote for American Idol. It took some time, many questions, and I think one of my cousins got it too. So it was very thorough. And some of the questions I didn't really have an answer for, so that may be data that messed up.
No, not messed up. It's again, the goal of the Resident Voices survey was to capture your experience and your perception about the things that you are able to have access to, the things that you have access to, your level of confidence in your ability to meet the goals that you've set for yourself, whether those are your economic or financial goals, whether these are your goals for the future. It's really kind of, again, having this additional lens to the things that we naturally count, right? Who's employed, who's not employed, how many people own homes, right? So those are all important data. But then if home ownership is a goal for you and you have a perception that you can meet it, what does that look like? Even if we ask you, do you own a home? And you check that box as, okay, I don't own my own home yet, but again, I'm also optimistic about the future. What does that dynamic look like when we cross those two important data types? When you say for the resident voices survey or the external data. So remember, we have external data in the map that's just asking you about, for instance, we can map out whether or not you're, say, 5 miles from a health provider or something like that, right? So those hard data is in the map. But for the question for healthcare, we ask about your level of satisfaction with access to quality healthcare. That was the question. So we asked you, overall, how satisfied are you in your ability to access quality healthcare? So again, perception, my perception of what I think quality is, right? So we didn't define quality healthcare for the respondent, if that makes sense.
So just to clarify, the healthcare in general wasn't defined either. So someone may look at it from a physical healthcare standpoint, behavioral health, mental health standpoint, any type of variance of wellness. It was up to interpretation of the person completing the survey.
We asked specifically about on the survey about mental health. We asked about if you've ever been diagnosed with any, and we had a list of physical health conditions. So in that measure rolled up, there's a number of different questions.
Okay, so is that able to be de-aggregated?
Yes. So when you look at the map, you can go in and under either the external or Gallup survey data. I didn't want it to get too wonky and blunky, me clicking through. You can find all the questions that were included on the resident voices survey, and you could pick any question and look at the data on that. Yeah.
Good morning.
Good morning.
So I'm a non-researcher, and I'm just curious. That was my first question. Did you provide consistent definitions of the terms? And I hear that you said it was more perception. But as a non-researcher, I'm curious from some of the researchers in the room, how do you really use perception data? So as an example, on the education piece, it had like 54% of Detroiters feel confident, how was it, about the education quality, and maybe 74% for the other places. But we know that we're 44th in this country as a state. So I'm still working on education quality. So even if we feel that, the majority of us feel, how do you use that kind of perception data? Because sometimes I feel like it can be dangerous to have that when you know that there are real systemic issues that need to be addressed.
I love that question because we all know, right, the averages. So it might be 54% overall for the region, but one of the things that we wanted to make sure is that might be 33% somewhere else in the neighborhood, right? So the way we ask the question, we try to bring it down to the respondent level of experience, which is my neighborhood, right? Which is why we're bringing it, because that 54 is not consistent across all of the neighborhoods that we have data for within the region, right? So you'll see some variability. And that's also when you think about how do you interpret someone's perception, we ask you feel good about it? It would be like, okay, well, I feel good about the quality of public schools because I'm, again, referencing when I went to school, right? Especially if I don't have a child of school age in my household. It's my perception of whether or not I think the schools in my neighborhood are good quality schools. The reason why and how I would say you use that perception data is, how does that perception drive behavior, right? In terms of, on the same survey, you could look at those who have a high perception of public schools and then look at it against a question around your intent to leave your neighborhood or where you live, leave your area. So you could put those two questions like, how is the perception of the quality of schools impacting another survey question about my intent to leave, right? Because we know, especially for particular age groups in this survey, that those between the ages of 18 and 29 really aren't that confident about the schools. So what does that look like if you have low confidence in the quality of schools? Do we see any correlation between your intent to stay or leave the area, right? So that's one of the ways to look at how does perception might impact or influence behavior.
Yes, and one thing she did just reference is we wanted to be for sure that we got a wide range of age demographic. And so when we were looking and seeing that, especially in the city of Detroit, our older, mid-level age folks were really filling it out, but we felt like we needed to hit a demographic that would be closer to some of the questions and issues that we're looking at. So we did do a round where we asked, like, hey, please have your 17 to 19-year-old fill out this survey. So we could get a wider range of data. So I just wanted to add that as well.
Yeah. And in survey data geek term, we oversample younger Detroiters.
Yes, yes, we did.
I have less of a question and more of a comment and a sense of gratitude. I just want to thank you and your team, Chris, Camille, obviously Marnita and Sandy. So you've been doing this study for a while, and you mentioned the Durfee neighborhood. Of course, that's where our organization, Life Remodel, does a lot of neighborhood revitalization work. And for us, and for people who are working on the ground level, being able to have not only the information and the data that speaks to a specific neighborhood, not only is that invaluable, but I want to double down on something that you said about perception. I think a lot of polls and surveys that are done don't provide the sense of agency that you all did in this particular survey, to not necessarily to start with what is a residence or what is a neighborhood's personal perception of how they see thriving indicators, like you mentioned, in their neighborhood. And for us, I know you've mentioned a couple of times Durfee as being an outlier. I would humbly say that some of that outlier might be because of the work that we do, but I just think that providing that sense of agency, allowing for it to be not only mixed with hard data, but also people's feelings about how they contextualize their experiences in their neighborhood, gives data points to then be able to see what's working, assess what's not working, and then be able to build on that perception to then be able to drive, as you mentioned, behavior and other outcomes. So I just wanted to thank you for the uniqueness of this particular survey compared to other data surveys, and how for someone who's working on a very neighborhood and community-based level, how important that information is for us to be able to understand what's working, what's not working, and then be able to drive outcomes and behavior in that way. So thank you.
Absolutely. No, it's my pleasure. Thank you.
Hi there. Hi there. I live in the city of Detroit. I don't remember, sadly, ever receiving the survey, unless I perceived it as junk mail, and I'm very sorry if that's the case. So there's a little bit of a two-part question here, which is, was there any kind of publicity out about anticipate getting this type of survey, or how to get the word out so when people received it, they understood what it was? And to your 18, 29-year-old demographic, I'm trying to understand, was there any social media output about the survey to really reach that demographic? Because as we know, mail is not the thing. But my other question is, I'm trying to understand too, this woman over here mentioned that it was 2022. We're in a very different time right now, as we know, in 2026. With the current administration that really has had a large impact on a city like Detroit. So is there another survey anticipated soon that will now, because I can imagine some of these questions, the answers to some of these questions are going to be very different right now. And I'm wondering if this also gets distributed to elected officials at all levels in some way.
Okay, so first, when we did the survey, we partnered with the data folks that we mentioned, and we did not do a social media campaign. That wasn't a part of the scope of work for it. We mailed it out to everyone, and then we also, you could click online and fill it out online. And so we got both results from both areas, but no, we didn't do a big, large media campaign, but we got it out to 11,000 folks with the city of Detroit and the Tri-County region. So Wayne, Oakland, and Macomb counties. And to get 11,000 back, I'm learning now that I've started being with our data folks, is that was a good result to get that back, whether it was on the email or from the mail. And then in relationship to next steps, as far as funding, I'll do a shameless plug. It requires funding to be able to do the survey again. And so that is our hope and that is our goal. But right now, we wanted to make sure that we had the data out in a way that everyone could access it, but then us also matching it with national numbers. I'm told from my research team that when they're doing things, they go and they sometimes, when data hits, is a little bit behind the curve. Yes, I'm sure it's absolutely different now, but it's going to take, you know, funding to be able to do the survey again. Mm-hmm. Did I answer? Okay, so when we were informing the survey, we worked with, and when I say informing, we were developing it. And so Gallup came in and they said, we don't want to just do it regularly. We want to talk with the data folks, government. So we had philanthropic, government, community, CDOs, everyone at the table when we were developing this survey. When we rolled it out here at the policy conference. And so government is aware of the data, and then we make sure that with this launch that we're having them at the table. City of Detroit, Wayne, Oakland, Macomb counties. We just talked with Mark Hackle about it yesterday. So, and connecting him to get the data. So we do want them to make data-informed strategic decisions, and so have access to all of this. So we do work with all of the sectors to make sure that they're linked and have access to this data.
The only thing I would add to that, Marnita, related to the age of the data, yes, we understand that people's experiences have changed, but we also want to make sure that you have data long enough to make sure that people are acting on it, right? And I think that part of the thing is, in the interest of also fresh, recent data, because we understand that people's resident experiences have changed, is how have we used the data that we have? Because any data is a snapshot in time, right? So if you took a picture and you're saying this is what the picture looked like then, if we say we only have to have the most updated data in order to act, I think that there is some frustration there among those who participate in survey, because one of the questions you always get is, what did you do with the last set of data? And so part of it is, yes, the recency matter because this might be stale and old and we have to acknowledge it. But I think it's also how have we used the last set of data? And one of the things that we know, and that was something that when we discussed what should be different, is if you don't give people access to make decision on the data. So it might be like, how far, maybe the conversation is not just like, okay, this data is old, so I can't use it, but how different does it look today on any of the question? But at least you have an understanding of where you're starting from, right? So I would just use that as a shameless plug to not have the fact that it was 2022, 2023 data snapshot to prevent us from saying, how can I use this and leverage this data in my decision making? It might lead you to say, why would I expect something to be different today based on this percentage that I saw that when it was collected? And it might be, you know what, healthcare should look different because we just had a brand new, clinic open in this neighborhood. And so we expect this to be different. And so we shouldn't be at 33%, right? So what does it look today? And it might lead you to ask your own question, right? Around, has the building of this health center impacted residents' perception about their ability to access quality care, right? So I say still figure out in ways how you can use and leverage the data, even though we know it was a snapshot a few years ago.
Okay. All right, so it's 9:22. The main session is about to start in the theater. So thank you so much for taking your time this morning to come and be with us. You'll see me running around all through the conference. Feel free to pull me aside and talk with me, or I am in the app. Reach out and I'll be glad to meet with you one-on-one and to have you a part of the community, especially you, a part of the community reveal that we're going to do in June. Thank you so much.